Dr. Garana.
Hi.
Good afternoon.
Good afternoon.
Today we're gonna talk about veins.
I think so, yes.
Spider veins.
Spider veins, thread veins. I don't know whether we call them anything else.
You have veins, don't worry. You have veins.
We all have veins.
We all have veins, of course. But they don't show. The ones that are like spiders.
The red ones.
Like the red ones, the purpley ones, the ones that, you know, show.
And give us a background about them, because there are varicose veins.
Yes, exactly, the different type.
There's, let's say, we can divide the veins in two different levels, right? The deeper level veins are where we get the varicose veins. And unfortunately, it's more of a complex problem, so it's not something that we treat.
Not cosmetic, but it's
exactly. It's surgical, and we generally refer our clients with varicose issues to vascular surgeons. The veins that we do treat are the more superficial ones and the ones that are the most unsightly, yes, and they bother a lot of people. They unfortunately can present very early on. So you can have 25-year-olds with these kind of problems.
They can be genetic, right?
Yes, a lot of them are, or rather a big component of that appearance of veins is genetic. So if your mom, dad, nannu, nanna had...
But if it's not genetic, what can cause them?
So women are more affected than men because of estrogen. Individuals who stand for long periods of time.
Shoes, I suppose.
Shoes, high-heeled shoes have been, yes, hypothesized to cause them. What happens is, so when our heart pumps blood down to our legs, right, through arteries, the blood then comes back through the veins. Don't forget, it's going against gravity. So it takes a lot more effort for that blood to come back up. So the venous system, all the veins, have these little flaps, we call them valves. So when the blood gets pushed up against gravity, those valves close and stop the blood from going back. So the idea is to get a smooth flow of blood back to the...
Like when you're abseiling.
Kind of, exactly. So when you're abseiling, it's a good example. So when you're abseiling, you know, when you stop for that 1 second pause to kind of catch your breath so that you go back up again, that's essentially what these valves do. They give you
the pause.
a bit more support so that the blood can go back up. So what happens in varicose veins particularly is that these valves start to malfunction for one reason or other. So they weaken, and then we get backflow of blood. And that's what happens when you get blood going back down into a tube. You have too much blood, a weak tube, and then you get dilation. And that's what these varicosities are. A collection of slow-moving blood in a tube.
It's a jam.
Yes, exactly. It's like the Marsa bypass. Or the Attard bypass, or the... Exactly. So, unfortunately, when the issue is that deep, we need to intervene surgically. But because of all this backflow of blood and this pressure that this blood is causing, it's relayed onto the superficial veins, so the veins that we see, these thread veins and spider veins generally occur due to the same principle. Too much slow-moving blood, and then these veins just can't hold it anymore and they dilate.
What can we do to prevent that before we come to you?
So prevention is... It's not impossible, it's very difficult. One, you can't prevent your genes.
That's for sure.
So no matter how fit you are, how active you are, how much you, elevate your feet during the day, you can still be prone to developing them. And I know a lot of people who are super fit, super healthy, and have developed veins really early
But
on.
then we have Dr. Garana.
then we magically remove them, pretty much like anything else we do here. It's like a wave of a wand and it goes away.
Għabba il-telespettaturi, nitkellmu l-lum fuq dak il-vini l-homor thread veins dawk li huma jisom
Spider.
Spider veins. U qed tgħidilna Dr. Gorana li kulħadd jista' jkollu, ġifieri anke mill-età ta' 20 sena, issa ġenetika ma tantx tista' issibla kaptu, ġenetika hija ġenetika. Imma u qed tgħidilna wkoll id-differenza bejn varicose veins u dawn it-thread veins. Qed tgħidilna l-varicose veins bil-forsi trid tmur għas-surgery, però dawn il-ħomor l-irqaq tistgħu jiġu trattati faċilment u ħadd ispjegalna kif ħatamilhom faċilment. Jista' juża kulħadd għaltilna xejn. Fakkarni.
Anyone can be treated.
Well, we select our
Age,
clients.
any age. Let's start with age.
Yes, more or less age isn't a factor. Young, old.
Conditions perhaps.
Conditions, you don't want to be treating
Tuberculosis, maybe.
Diabetes perhaps.
diabetes is a big one because unfortunately they already have vascular complications. People with varicose veins tend to not do very well because we treat the little ones on the surface, but there's still big problems in the deep venous systems. So we're a bit selective, we don't want to treat anyone who has had deep vein thrombosis in the past, anybody with any kind of serious medical conditions.
Ġifieri qed tgħidilna min kellu xi trombosi ovvjament ma tistax issir, qed tgħidilna wkoll
pregnancy, we don't.
Pregnancy. Qed tgħidilna wkoll min għandu diabete ovvjament għax nafu wkoll sakemm tiħilja l-ġilda dawk ikollhom ftit tal-problemi ma min idejquhom dawk il-vini rqaq ħomor jistgħu jiġu faċilment imneħħija. Għax hawn għandu saqħ sbieħ tgħidilna wkoll m'għandekx għalfejn jiġu anke jekk tkun fit, ġifieri jekk teżerċita ruħek, ma min għandu saqħ veru sbieħ mbagħad idejquh waqfien ukoll. Yes.
Now the treatment. What does it entail?
The treatment is called Microsclerotherapy. Essentially, micro is because we're injecting small vessels. Sclero means we're going to make something, sclera is kind of hardening something, and therapy is therapy. So what we do is we use a number of agents, it doesn't really matter, they're all effective. And we inject directly into those little vessels. So we inject this irritating agent, which is going to cause the vein to collapse on itself and die. It dies and the body cleans up that dead vein and the blood finds another way to get to where it needs to go, because obviously we don't want to stop blood flow, we just want to stop blood flow in that area. So exactly, so we inject small amounts, it's generally 5, maybe 10 milliliters of solution directly into that thread vein or spider vein, and you can see it disappear before your eyes. Yes. And then
obviously it has to be visible from the skin for you to inject.
Yes, for sure. And we use a little light which helps me find the veins and see what kind of veins they are and whether we can inject or not. And once the treatment is ready, once we've kind of covered the area that we want to cover, we get the clients to put on compression tights immediately. So that's a really important post-procedural advice.
When it comes to veins, you have to.
Exactly. So we're working on pressure, blood. So if we don't have compliant clients, the results generally fail. So after the treatment, we get the stockings on. They're nice and tight. Don't forget, we can't really do this in summer because the stockings are also warm.
The heat.
And we tell people to avoid heavy exercise and to keep those tights on for
how long?
Ideally, it's 3 weeks. No, resting, you don't need to rest so much. Actually, you can even go for a little walk just to get that blood moving.
Okay, circulation.
Any side effects, perhaps pain?
Pain is minimal because we're so close to the surface of the skin, so it's
And how long will the
No
treatment
pain.
take?
Depends on how much we're treating. I'd say 30-45 minutes.
Mainly on the legs, I'm assuming. no?
Legs, waist down. Waist up, it's very rare to have some kind of thread, spider veins there, and if you do, we try to target them with laser as opposed to
One shot, one treatment? Or do they
a
have
couple
to
of shots, one treatment. But yes.
Couple of treatments?
Couple of treatments, I mean,
Within a month, 2, 3?
you're talking about laser or the sclerotherapy?
The therapy?
No, it's one
Just
treatment, yes, and then we see how clients do, and if needs be, we continue. Generally, once we've treated an area, it doesn't open up. If people obey the advice that we give them, they stay closed.
That's perfect.
Ġifiri, għettajdinna Dr. Gorana li fi trattament wieħed jekk bridem ikun disciplinat. Tajdinna l-bsu dawk it-tajt.
Tamel operazzjoni
Tal-bypass, per eżempju, l-bsuhom dawk it-tajt.
Eżatt.
Min jagħmel dawk hemm bżonn ovvjament fejn jitlu il-vini għandhom bżonn iktar compression, x'qaltilna ta' interess iktar li fi trattament wieħed
Ridhom, għax dak il-ħin jisparixxu l-vini.